Good afternoon, everybody. This is Carla Sutter with SYNERGY HomeCare, and very excited to be able to present today's webinar, Advanced Care Planning and Healthcare Directives, Communicating and Documenting Your Healthcare Wishes. After the webinar, for those who are needing a certificate of attendance, I will have contact information for you to be able to connect with me and receive your document. So again, this seems like the most appropriate visual when we're talking about advanced care planning and healthcare directives. For many, we think about this document in relation to end of life and death and dying, and certainly there is aspects of that, which I think is why there is this idea of the elephant in the room and not wanting to communicate. My hope is that by the end of today's session, there will be a greater comfort for those of you who have not completed a document to be able to have this conversation with family and friends. And for those of you who are working with clients and patients to have these conversations, a renewed kind of encouragement that it is our responsibility to be able to have this kind of conversation. And if we are doing it from a professional perspective, that it is also our responsibility to have a document of our own before we think that it's okay to be asking others to complete the document. Because as you're going to learn, this is not a document of ill health or end of life. This is a document for all of us who are living presently healthy and perhaps ill lives, but particularly for those of us who have a luxury right now of not having issues and concerns to be able to start this dialogue. The reality with these documents is that it always seems too early until it's too late. And that truly is, there's a lot of different documents out there, and this is one of those that, again, we never can know when is the right time, because none of us know when an accident, an illness, a situation is going to change our health status to a point where we no longer can communicate our wishes, even if it's for only a short period of time, and we return to good health. But in that interim, it is what is important that our wishes are upheld and communicated by those who understand them. This webinar is not meant for financial or legal planning purposes and educational nature. Particularly around healthcare directives, it's important that you are working with your healthcare team, that you're communicating with your physician as well as your family members to ensure that the document that you complete is understood by all of those who would be using it when you are no longer able to communicate. I truly believe that these documents reflect the voice of the heart. They are a gift to our family and a way to ensure that our wishes are followed. And I think that if we can switch our perspective on them, if we really think of this as a gift to others versus a burdensome task, then I think it much more the focus is going to be on completion. We will have a higher rate of documents that are available to us, and we're really going to then also know what our family and friends who have asked for our guidance and assistance, what their wishes are. This is about honoring choices. And truly, these documents are about choices. I hope as we go through the slides during this hour that the one thing that comes out is that there is no bias in terms of how these documents should be completed. These documents, no matter what one's wishes are, no matter where those wishes are formed from, that they are your choices, and that it is important that no matter what your choices are, that you communicate and document them. My hope is that at the end of this hour, that you will have a better understanding of what advanced care planning is, that you will have a greater understanding of your options for healthcare documents, that you will know who to speak or who can speak for you in case you can't speak for yourself. You will know how to initiate this crucial conversation, whether that is with clients and patients or that is with family and friends, and know the next steps that you need to take in order to do that. Why should any one of us concern ourselves with this topic? There are so many more interesting, exciting, happy topics to be discussing. But this is such an important one. There is no easy way to plan for healthcare choices. It's a process that involves careful consideration and communication about sensitive and sometimes complex situations. The facts about how we die are clear. Most of us will die after experiencing a chronic, progressive, and ultimately fatal illness. Approximately 80% of deaths will occur under the care of health professionals in some type of health organization. And when the time comes to make important end-of-life decisions, approximately 50% of people are incapable of participating in those decisions. And that incapability comes from several situations. It may come from a cognitive or mental decline, a disease such as Alzheimer's or dementia. It may come from a traumatic brain injury. It may come from being in a vegetative state. It may come from being in a medically induced coma. When health professionals are uncertain about what decisions to make, the default will always be to treat. And again, that's why it is important that this document is completed, that our families know our wishes, because again, when health professionals are uncertain about what decisions to make, the default will be to treat. If health professionals or loved ones have not spoken with a patient about end-of-life issues, they cannot reliably predict what the patient would have chosen, and they find the decision-making responsibility burdensome and stressful. So what is advanced care planning? It is a conversation that takes place between loved ones on end-of-life care wishes and preferences. It's a conversation that takes place between professionals, healthcare professionals, social workers, chaplains, nurses, physicians, etc., on end-of-life care wishes and preferences. It is a process that identifies what is most important to you concerning quality of life and living. And as I shared before, the most important thing is that there is no right or wrong in advanced care planning. Your decisions and values are simply your preferences for end-of-life care. I truly believe that these are documents of choice and not of limitations. While you may choose to limit the treatment that you receive at any one point in your healthcare journey, that still is your choice, and it still is all about options. Many people will say, I can't make a decision, I can't complete a document, I don't know. Please remember that not completing a healthcare directive is making a decision. It is making a decision to receive all the care from the medical facility until no more can be done. So again, not completing a document is still making a choice. I think it's really important to have some definitions. So advanced care planning really is an umbrella term, and it is a facilitated process. This is not about just checking a box and moving on. The best advanced care planning is really done with conversation. It's really done in what we would call a qualitative way. It's not about check boxes and forms as much as it is about just dialogue and conversation to initiate. And then the document itself, the boxes and the checks by themselves, are are where we go to. An advance directive is a patient-directed document, and we're going to talk a little bit more about what would fall under an advance directive. Because I'm talking to a national audience, the language that is utilized in your state is often very different than what's utilized in another state. It means the same thing. The outcome and the use of the document is the same, but the language itself may be different. So for example, here in Arizona, we call it a living will. In Minnesota, it's called a healthcare directive. Here in Arizona, the person elected to be the voice of decisions you have made is called a medical power of attorney, where in Minnesota, for example, it's your healthcare agent. So I'm going to try to utilize the different terms and explain that, but please know that again, in your state, there may be some different terminology. A POLST document, and in some states it's called a MOLST, M-O-L-S-T, or a MOST, M-O-S-T, is a provider order used to translate patients' wishes. And we're going to talk further about that as we move into more definitions, because again, this is a newer document that is utilized in more of a medical order versus a legal decision-making tool. Each falls under advanced care planning. Each is important for patients and clients to have, although not necessarily to have from the beginning of your planning process, and sometimes dependent on your age or your diagnosis. But again, each are unique and separate kind of aspects to the whole advanced care planning process. So why is today the day to have this conversation? I have a couple of stories to share that I'm hoping will kind of give some reasoning behind why this is so key. The first I call the highway story because it happened on a conversation personally with my husband. So I, as a social worker, have worked in hospice and worked for hospice for many years. And in doing so, was involved intimately with many different families and clients who were dealing with a variety of advanced illnesses and making choices every day about what treatments to have. And this, of course, would impact my own kind of thinking and processing of what I would want for myself if I was in any type of similar situation. My husband, who is not in the field, would often just kind of go along with my conversation as I would talk about, these end-of-life healthcare situations, and typically would just be nodding his head, and I would see that as just agreeing with me, as a loved one, as someone who kind of would agree with much of what I say, as many people's partners or spouses would. I just accepted that he was agreeing with me in what I was saying that I would want in my own healthcare situation. So one day we were driving and driving on the highway at highway speed, and a situation had happened in my work, and I shared with him that I was going to make some adjustments to my healthcare directive, reflective of some of the thoughts that I was having after this client situation. And what it taught me next was a couple of things. One, don't have crucial conversations when you're driving down the highway at 75 miles an hour, because it's probably not the safest situation. And two, that although you are with somebody who loves you and respects you and agrees with much of what you have to say, it does not mean that they agree with everything that you have to say. And it was the first time that my husband said, if that's your wish, I don't think I can be your healthcare agent. What it allowed me to do, because I was having this conversation in a place of health, was that I could talk through a little bit more with him what my thinking was, where this came from, what my hopes were, what quality of life meant for me. And in that conversation, he was able to really understand a little bit more than just the words themselves, and came to a place where he still felt comfortable being able to represent my wishes, different from his own, but still represent my wishes. Had I not communicated this, had I simply documented these wishes, put it away in a drawer, and when something happened, he brought it out, not really ever having read it, and the physician shared with him what the wishes were, I would have put him in an untenable position to, one, support something that he personally wasn't supportive of, and feel that he didn't really have a choice. So again, it is why it's so important to have these conversations early on, to really be able to have a conversation and express what the wishes are and be able to kind of move forward. The other situation is, many years ago, had a friend and colleague who experienced something with a close person in her life, who had a sudden health situation that left him unable to communicate his wishes. He was fairly young and so had not completed a document. She was not in a legal position to make those decisions, which happens to many people. You know, we have lots of people in family situations. They may not be married. Their marriage may not be seen and supported in that state. And they don't have a legal voice to be next of kin, to be the person that would be able to legally make decisions. She was in a lucky situation that the family, his family, allowed her to move forward and make those decisions. But without a document clearly identifying what he wanted, it added burden to an already crisis and very difficult situation to come up with thinking about what it was that he would want. And what happened was his teenage son shared that when he got his driver's license, his dad didn't want him getting his driver's license and wasn't going to sign for it unless he checked off organ donation. And that conversation helped guide the decisions that they made in terms of what next to do and what his wishes were, even though they hadn't had a direct conversation previously. But what a difficult time for all the family members to have to kind of find situations that represented what he would want. It really, again, was a learning lesson for all, not just for that family, but really for anybody who was close to that situation, to really go out and make decisions, no matter where they were in their lives, no matter what health status they were, so that wasn't going to have to be repeated. Healthcare directives are legal documents. There is legal statutes associated with what makes them able to be followed. So it is important to understand in your state what those legal guidelines are. They should be created prior to a serious illness. And we're going to move forward later and talk about when you would make adjustments. But these can be done and should be done before serious illness. They are used to communicate the person's wishes to family, physician, and other providers. They need to be completed and signed by the person making those choices, and depending on your state, either witnessed or notarized. And again, there's some very unique features in each state that guide that. Some require one witness, some two, or a notary. So there's some specific things that you need to understand about the documents in your particular state. They are used to prevent legal and moral problems. Many of us remember, years ago, a situation in Florida with a young woman who, again, had a traumatic accident and was in a vegetative state. The family disagreed with the husband's stance on what wanted to happen, and it ended up, there was no document, and it ended up going to court. It became a very public situation, and these are really used to avoid having that happen. These documents will allow, either through the one document or adding an additional document, for the person to assign a healthcare agent, a medical power of attorney, to speak on that person's behalf should they not be able to communicate. I like to see that person, that healthcare agent, in our minds, to really think of them as the voice for the decisions that we as the client, we as the patient have already made, and that they really aren't making decisions. They're making the person's decision that they're representing known to those around them. Many studies revealed that more than 60% of individuals aged 18 or older want their end-of-life wishes to be respected. However, only about a third of them had actually completed an advance directive. These documents don't have a high completion rate, and they have no higher completion rate within the healthcare industry, within those that serve everyday clients and patients in healthcare settings, than those who are just consumers and patients. So why is that? A lot of it goes back to the very simple fact that there is a resistance in this country about thinking about death. There's a resistance that if I sign this document, I am somehow going to bring this closer into my life. For many, there is just simply not an awareness of advance directives to begin with, that there's not an understanding that these documents even exist. In addition, there is some incompatibility with ethnic cultures. So some ethnic cultures, this is not the way that decisions are made. And so it becomes a more difficult situation for healthcare providers to really understand what the patient's decisions are, separate from what the family dynamic in that culture may represent. For others, these can be very technical documents. Even those that are done very simply, people feel that there's technical language, that there's health-specific language, and that the legal requirements. So many patients believe that they have completed a document only to find out, and oftentimes family to find out, that the document was started, but it was not completed to a point where it is kind of a legally binding. And depending on who has been asked to be a healthcare agent, if that aspect has not been formalized legally, it may not be allowed to be that person that was represented to be the person that they wanted to have it assigned to, and instead it goes to a next of kin. There's an inconvenience or an irrelevance of discussion at legally mandated times. So hospitals are required to ask the question upon admission if you have a living will or a healthcare directive. Oftentimes in that moment, there's crisis, there's confusion, and people may not really even understand the question and may answer in ways that don't truly represent what is available. The other issue is that very rarely does that staff come back to that patient and family when things have calmed down and say, you represented upon admission that you had a healthcare directive. Do you have a copy of it? Can we review it? Does it continue to reflect your wishes as it stands today? Or I see you don't have a healthcare directive. Can we set you up with someone to have this conversation and begin the process to complete a document? And often there's poor preparation or motivation of personnel who must initiate the discussion. Just because people are in the healthcare field, it doesn't always mean that they feel the most comfortable having these conversations. Not everybody who works in the healthcare setting is probably the right person to have the conversation all the way through completion, although we can all have a conversation to get a client and family and patient to a place where at least we've generated questions to be able to talk with the healthcare professionals to answer to the point where someone's comfortable completing a document. Completing a healthcare directive is more about thinking about what we believe and what we value, which are shaped by the experiences we've had, whether those are religious, family traditions, or history. And it's more as much about that as it is about our present health status or health history. In fact, many times we don't need to have any knowledge of what treatments are available or what our health status is. It is much more about thinking about what our goals are, how we define medical success, what is quality of life for us, what have we seen in terms of our family medical history that is concerning, what have we seen in other situations with family and friends as they've gone through their health status situations. We need to understand, do we have any present health issues? Do those complicate our own health status? We also have to think about the future. Again, are there significant health issues that could face us in the future? And how would decisions be made and by whom, if not by you? One of the most difficult aspects of completing a healthcare directive really falls down to having to complete and choose a healthcare proxy. Now, while you don't have to do that, and you can have simply a living will or healthcare directive that simply talks about your wishes, talks about what quality of life is, talks about medical interventions that you may or may not want, you don't have to include choosing a healthcare proxy. But it certainly ensures in a greater way that those wishes will be communicated, will be held up in the particular ways that you want, and not have to be interpreted by healthcare professionals who may not always know and understand the way that you're documenting this and writing it. I believe that one of the same reasons that we often don't choose a healthcare proxy, which sometimes kind of negates us from even completing any part of the healthcare directive, is the same reason that families with young children often don't complete a financial will, where they would be choosing someone to be the surrogate family for their young children who are minors. And that's because no one wants to make a choice between often very good, decent, caring people who all would love those children, but not everybody can be their guardian. And I think that that's one of the reasons that we struggle with sometimes choosing a healthcare proxy, is we don't want to play favorites. And the reality is, if we asked family members who we were choosing among, would they be unhappy or upset or jealous if we went with somebody else in the family? Very rarely would they, because not everybody feels comfortable and confident making these kind of decisions. Oftentimes we choose the healthcare agent and the proxy based on age. Maybe it's just the oldest child in the family who takes that role, when in fact they may not be the best versed in terms of their comfort level with thinking about and talking about healthcare decisions. They may not be the most emotionally stable in times of crisis. There may be someone else who manages crisis better. And so it really goes back to having that conversation. It doesn't mean that by choosing child A over child B, that child B doesn't have a voice in the conversation, can't participate in the healthcare decisions. It just means when it comes down to the final decision maker, that the healthcare team is going to look towards one person. Now, you can appoint people to act in a co-agent way, but it becomes a little bit more difficult when you think about two people acting as a decision maker for anything. I will tell you, in my own family, my husband's family, there were 4 boys, all living in a pretty good proximity, in helping his mother do her healthcare directive and then choose a healthcare agent. She made a choice based on who was the closest in location to her. I think for her, that just felt like, okay, if I go by mileage, I'm going to avoid anything else. But we specifically wrote in the document that all the boys could participate in the healthcare conference. They could all have access to her medical records. They, could all ask questions and contact the physician. There were different things that were put in so that, again, when it came down to the decision making, one person was chosen, but it involved all of them. So there was a way to kind of minimize that feeling of playing favorites. One of the other reasons is we always think there's time. We don't have to make that decision today because nothing's going to happen. But that's not true. And oftentimes some of the most difficult decisions have to be made not when there is a diagnosis of, let's say, a terminal cancer, where there is going to be some time to make some choices and put some of the affairs together, but there's a car accident where somebody is in a critical acute situation, needing surgery, being in a coma, where there is no planning time. And none of us know when that's going to happen. So today is the best day to complete these documents. We have diverse family situations nowadays. We have stepchildren. We have unmarried partners living together for years and years who really are the best decision makers for each other, but it's not represented in the legal statutes that they would be the one who could make those decisions. The other piece is next of kin. So it's important to understand that in every state, there is a next of kin kind of guideline that lists who the next of kin would be for any one person. And depending on your family structure, it will start with a spouse, a legal married spouse. It would then go to adult children over the age of 18, and then parents, and then siblings, and et cetera, et cetera. It does not go, when it comes to siblings, and you have 5 of them, it would not go that the sibling you liked the best gets to make the choice, or the sibling that is the oldest makes the choice. In those situations, when there's a group of people that just fall under that next of kin statute, it would be that those siblings would have to together make those decisions. So you can see that can get complex. You can also recognize that some of the people in that list may not be people you've had a strong relationship with. You may be disconnected from your family. You may have your closest relationships with friends, but if they are not the one who you have legally documented as your agent, they don't have standing in the healthcare setting. So understanding that is really important, so that it is one more motivation to be able to complete these documents. Traditionally, family members do act as surrogate decision makers because they most likely know the person's preferences and will act in the best interest. However, again, sometimes family members are unable to make decisions. There's conflicting personalities, values, or interests, or there's estrangement. Today's varied family arrangements, same-sex partnerships, unmarried couples, second marriages make it that much more complicated. Everything may be fine until it's not. And I will tell you that in my years of working both in hospice and also working with families along the long-term care journey, I've seen many families that in normal, non-stressful situations work very well, but as stress increases, people become much more controlling because they can't control what's happening to their loved one. And so oftentimes the positive functional decision-making tends to go away the more stress there is. It's important to discuss wishes with those you name as the agent. This should not be done in a vacuum. You should not complete documents and just assume that Billy is going to go along with everything. As I shared my own story with my husband, he agrees with me on a lot of things, but he really needed to understand in a deeper level of conversation exactly what I was asking for. So these documents should always be shared with family members, particularly the one that you are going to choose as your decision maker. Not all close family members will make good healthcare agents. Maybe you have a family member who travels all the time and is really unreachable because of their travel schedule. You want somebody who's available. You want somebody who, in a time of crisis, can manage emotionally, is able to have conversations and be able to be a good listener and really hear what somebody's saying. That their own beliefs do not kind of complicate your wishes because they don't agree with them. And there's a lot of people who are great agents for somebody's wishes that would have a completely different choice for their own situation. And if you read their document, if they had a healthcare document, it would look very different, but it doesn't mean that they can't still be a good representative of your wishes. How can one plan for all future healthcare options? Providing instructions for future healthcare decisions can often seem like an impossible task. None of us have a crystal ball. How can anyone plan for all the possibilities? So instead, we really need to consider some of the following questions. When would it make sense to continue certain treatments in an effort to prolong life and seek recovery? When would it make sense to stop or withhold certain treatments and accept the terminal nature of my disease or situation? Under any circumstances, what kind of comfort care would I want, including medication, spiritual guidance, and environmental options? So again, none of those questions specifically address a particular medical intervention, but they absolutely can help guide what that decision would be. I had a family years ago in hospice. The gentleman was an elderly man with end-stage Alzheimer's. And one of the symptoms with Alzheimer's in the end stage is that swallowing becomes quite difficult. Oftentimes, people will choke on food. And what happens is they aspirate the food or liquid. It goes into their lungs and it can cause infection and pneumonia. And this will be a continual complicating factor. This gentleman had that very situation. He was in the hospital. The physician asked his daughter, who was the designated agent, what would her dad want a feeding tube placed so that he no longer would be eating directly. The food would be fed through his, gastric system directly in a liquid form, so it would avoid the aspiration. It would not change the course of his illness. It would not change the course of the Alzheimer's and the terminal nature of the Alzheimer's where it was. We had a conversation and she said, I don't know. My dad never talked about a feeding tube. He didn't talk about aspiration. He didn't talk about pneumonia and how we would want that treated. But I had her review her dad's document, his healthcare directive. And what it did talk about was what quality of life was for him. That for him, the ability to communicate with others, the ability to be engaged in some aspect of family life, the quality of life that he no longer had, and while they weren't going to make, there was no other changes they could make that his body wasn't making, this situation could be changed by deciding after reading that he would not have wanted the feeding tube. So again, he never documented anything about a medical intervention, but his conversation about what was important to him, when would he want to prolong life, and what was spiritually and environmentally important for his care was clearly addressed, and it allowed her to make medical decisions and be able to help guide the healthcare team. Depending on what state you reside in, there may be different terms for advanced care documents. For instance, a living will and a healthcare directive is going to be this very similar document. They're written documents that help you tell doctors and healthcare teams how you want to be treated if you are dying or unconscious and cannot make decisions about emergency treatment. Living wills and healthcare directives will not guide first responders, as it is a legal document but not a medical order. So if your choice is not to be resuscitated, if your heart were to stop for whatever complicating reason, and the first responders come, you call 911, they come to your home, and you hand them the living will and the healthcare directive to read in there that it says no CPR, they cannot follow that. It is a legal document, but it is not a medical order. It is not signed by a physician. A durable power of attorney for healthcare, otherwise known as a healthcare agent or a healthcare proxy, depending on your state, can help make medical decisions on your behalf at the end of life or any other time you are not able to communicate. These decisions are best to be guided by a written document that you have completed, but can be based on conversations between you and the agent. You, as a healthcare agent, cannot guide first responders in their treatment, even if you have legal paperwork to show, because again, it is not a medical order. A POLST, a MOLST standing for provider or physician order for life-sustaining treatment, medical order for scope of treatment, medical order for life-sustaining treatment, is an approach to improving end-of-life care in the U.S. by encouraging providers to speak with patients and create specific medical orders to be honored by healthcare workers and first responders during a medical crisis. So these can be honored by an emergency provider, by the fire department, by a EMT, etc. Not all states have this program. And again, it is a medical order, although some of these do meet state guidelines and legal statutes, but again, it is a medical order. Another type of form is a pre-hospitalization DNR, which stands for Do Not Resuscitate. And this is, again, a state-specific document that guides EMS and first responders regarding a patient's decision to forego resuscitative measures in the event of a cardiopulmonary arrest. Resuscitative measures to be withheld can include chest compressions, CPR, assisted ventilation for breathing, defibrillation, and drugs to stimulate the heart. Not all state forms are the same. These types of forms are signed by the patient or a designated proxy, and either a physician or in some states also a nurse practitioner and a doctor of osteopathy can also sign. These type of forms need to be clearly posted or maintained near the patient so that the first responder can access it. The fridge in one's home is a good location for the display of this form, and you can even contact your non-emergency fire department number to ask for their guidance on where a placement of such a form would be. Once you have taken the important step of completing your advance directive, are you done? Not really. These documents are continual and need to continually reflect your healthcare wishes and will be best to do so if you review them on a regular basis to ensure that they continue to meet your needs. You should review your directives anytime your life circumstances change or one of the following Ds occur. A decade. A good way to remember to review your choices is on your birthday when you start a new decade. Death. Often the death of a loved one will cause you to see your own healthcare choices differently. Maybe you've watched them go through an illness or a treatment and intervention that you do or do not want for yourself. In addition, the individual who has died may have been named on one of your documents, and you would need to update this to involve someone else in the role. Divorce. If you experience a change in the makeup of your family, you will want to review your documents and consider updating them. While there are people who continue to have a ex-husband or spouse or ex-wife on their document as their agent, very rarely does this happen because, again, there's a reason most people are getting divorced, and oftentimes there's a disconnect in terms of how decisions are being made or choices are being made. So again, it's important to update documents because you may want to remove that person. A diagnosis, a new diagnosis of a serious health condition, or decline in an existing health condition that may worsen and that there may be potential complications that you had not previously considered when you had made your original choices. Again, as we change our health status, as our physical condition changes, we often make different decisions, and we often can't necessarily see what has been important before, and sometimes we move the line in the sand as to what is quality of life, what's successful treatment, often changes because you recognize that there's still enjoyment, there's still quality despite some limitations, and we sometimes can't see that in our healthiest moments. What are the limits to a healthcare document? The first is that your agent must be at least 18 years old, and you must be at least 18 years of age to complete a document. And it is really important to have those who are 18 and above complete these documents. They probably aren't going into the same level of specificity, but it is important, and it's amazing when I've spoken to young people Maybe I've been working with their family members who are completing the document and they themselves want a document completed. It's amazing that even in youth, how thoughtful they often are, and sometimes even more able to communicate what is important to them and how they want to see their lives to complete these documents. And often, again, because of the requirements in healthcare settings and the complexity of personal information and sharing that, having a document when your child goes off to college or they've turned 18 can be important, so that there is a decision maker before having to go through any kind of legal hoops. The other piece is, particularly if you have young adult children over the age of 18, maybe you are no longer married or in a strong relationship with the other parent. Again, there's a reason for that disconnect. Decision making probably has not gone well. And so you want to make sure that somebody is designated as the decision maker so that it can be a much smoother process in a healthcare crisis. In many states, your agent cannot be your healthcare provider unless the healthcare provider is a family member or you give reasons for naming of that agent in your directive. But it's very rare that you would ever want your healthcare provider to be your agent. And again, many states limit that. You cannot request healthcare treatment that is outside of reasonable medical practice. I can't put in my document that I would want all medications, even those that have never been tried in my specific diagnostic case, to be utilized. A physician cannot go and say, I've always wanted to see if this medication would work in this situation. I'm going to try it because his document says I can. You can't step outside of the bounds of medical practice and ethical and moral process. You also cannot request death with dignity under those death with dignity laws in states such as Oregon. It has been in the past sometimes known as assisted suicide, unless it is legal in your state. While these documents will transfer between states, it won't be any aspect of something that's legal in one state but not another. That aspect cannot be followed in the state that it is not legal or medically able to be done. Witnesses cannot be someone who benefits from your estate, depending on the state. So there are some where the witness, as long as they're over the age of 18, is fine to witness your document. In others, if that witness also would benefit from your financial estate, they cannot be a witness. They can be named as an agent, but they may not be able to be named as a witness. And that's where some of the unique natures of the state guidelines are. There are a lot of resources and tools available on the internet. This is where I think sometimes the internet can be a great tool because, again, there's some games even that have been developed. There's a great game called Go Wish. And it's a way for relatives or friends to actually play this game to really learn how you can best comfort loved ones when they need you most, and have conversations about different topics, what's important to you. It may surprise you, some of your answers. And so that's something you can purchase and be part of the process as you're going through completing your own document. Your physician office is a great resource for you to be able to have this conversation. Medicare does have benefits now for these conversations, particularly there's some particular times that your physician is able to bill your insurance provider for having these conversations. And even without that, your physician's office, many will have someone designated as a facilitator to have these conversations. Many state attorney general offices will have guidelines and forms that you can download for no cost that represent the guidelines of your state, and that's a good place. Many home care agencies, such as Synergy HomeCare, will be able to get you the forms for your state and be able to help facilitate the process towards completion. In Minnesota, there's a wonderful organization called Honoring Choices, and on their website there is some downloadable forms and a group of video vignettes that you can listen to really kind of, again, help initiate the conversation. They even have some that you could send to families to kind of start this process. Primetime has had some end-of-life planning videos and programs that are really wonderful. And again, if you're struggling to kind of think through this process, sometimes having an outside perspective and listening to other families and how they've experienced it can be helpful. Bill Moyers on PBS has done many different series on death and dying in our culture and has a series called On Our Own Terms. As I continue to move through the next few slides, if you do have some questions you would like me to answer, please begin to fill that in on the question box. Many people are familiar with a document called 5 Wishes, and that can be found at a website called agingwithdignity.org. 5 Wishes does not meet all state guidelines and often does not incorporate all aspects of a state form. However, it can be a good conversation starter and has some good open-ended questions to begin to explore values and philosophy of life that can be used to complete your state regulated documents. Another game that they have, a conversation game, is called My Gift of Grace. And it really is, the goal is to transform the experience of end-of-life communication for staff, patients, families, and communities. You know, it's hard to believe that sitting around with family members talking about end of life or what we would want in terms of healthcare wishes could be a good time. But I've actually seen when families have done this process together, and I've had the opportunity to facilitate those processes, I will say that there is often more laughter and levity at a clearly difficult moment in a family's life than not. It really allows to open up. It gets people to know each other in a way that they may not have known somebody's wishes. And there is nothing better than learning that when there's still time to be able to do something about it, when there's still time to ensure that you will be able to honor those wishes. So as we move into this, into the spring, and there is many holidays and opportunities for families and friends to be getting together at different events and holiday dinners, I challenge us all to think about this as an opportunity to maybe when we are hiding those eggs for Easter, to have an adult version. Maybe hide a few of these conversation game cards around, and family, everybody who picks one up has to respond at the dinner table. Or you roll up your state's form with some pretty spring ribbon, and people have that in their Easter basket, and different ways of doing that with the different holidays. And I say that somewhat tongue-in-cheek, but I know individuals who have taken that and gone ahead and done that. I had someone who reported back where they wouldn't have Thanksgiving pie and dessert for the family until they had some conversation about advanced care planning. And it doesn't mean that you're going to be completing the document in that moment, but it's starting the conversation. It's opening up the ability to be able to start talking about it. For those of you who have been on previous webinars, but for many of who this may be your first time coming to one of the Synergy HomeCare webinars, we have offices nationwide that are not only always interested in speaking with individuals who do want to work themselves with home care clients and provide supportive care as a caregiver, but we also have Synergy HomeCare offices located throughout the country who are available to not only provide caregivers for helping people whose lives have changed due to age or illness, but also to be resources for community needs and to be able to help families guide what they may need as an additional resource, in particular something like these documents, how to locate them, how to access them. And many who are coming to webinars such as this have an interest in understanding home care resources and may have an actual interest in becoming part of a system like Synergy Home Care, and be able to work with families on your own as part of an agency. So we do have opportunities around the country for that as well. This is a monthly series that we are doing, that these are free complimentary webinars being offered. If you like our Synergy Home Care Facebook page, you will keep current on all of the upcoming webinars and articles about caregiving and seniors. You can go to our website at synergyhomecare.com. At the bottom of the page, you can sign up for our email newsletter and be added to the email reminders on these. This month is a unique month. There's so much information to share that we are doing 2 webinars. Again, all of these have certificate of attendance that are available. And this one is called Aging with Purpose, Planning for a Meaningful Retirement. In April, which is Pet Month, we are going to be doing a webinar on the health benefits of pet ownership. And in May, we're going to be doing a webinar on successfully planning and achieving your short and long-term goals. Maybe in May, if you haven't yet completed this goal of having a healthcare document done, maybe come on to the May session and you'll learn some ways to ensure that by June you have completed it. Again, to learn more about how Synergy can assist you, a client or a patient, please don't hesitate to call our national number or reach us at synergyhomecare.com. And to receive your certificate of attendance, please contact us at Carla Sutter, C-A-R-L-A Sutter, at synergyhomecare.com. We also will put this recording up on our YouTube Synergy Home Care channel. So if you have friends or family that you would like to encourage or colleagues to watch this, please feel free to go to our YouTube channel within the next 24 hours. And this, along with all of our recorded webinars, are available to you at no charge. So I'm going to go and look at some of the questions. So again, the webinar will be up with the slides on our YouTube channel for you to review. Are there any additional questions on this topic, how to start the conversation, other concerns that individuals may have in terms of this topic? So yeah, if you're looking for the actual PowerPoint presentation, if you want to send an email to me at carlasutter@synergyhomecare.com, we can have that conversation. Also, I know that this is a personal kind of conversation, and if you do have a more personal question and you would like to have some additional conversation with me offline, please feel free to email me and we can do that as well. I'll just wait another minute to see if any other questions come up. So I really appreciate all of you who attended today, whether you are attending as someone who is going to facilitate these conversations for your clients and patients, or someone who is going to utilize this opportunity to move forward with their own document. I think it is so important that you have taken the opportunity to do so. There was a question, do these forms have to be registered with the court? No, they don't. So it's a great question, actually. They don't have to be registered with the court. It is always good to ensure that whoever you have named as your agent does have a copy. You would not want to have your healthcare directive not available and easily accessible. There are some states where you can actually register the document with the Attorney General's office. And you would have a passcode that you can have in your wallet and give to healthcare professionals, or it can be given, it may be looked for by other in the healthcare setting to be able to download the documents. So again, depending on your state, and you can find that information out on your state website. So again, thank you so much for attending. I hope that at the end we had over 125 attendees today. My hope is that if it stands and probably 75% did not have a healthcare directive, I hope that within the next month or so, many more of you have at least had the conversation with friends or family, and if not, have even gone one step further and completed the document. All right, thanks so much. And again, please reach out if you have any additional questions or comments, or want to receive your certificate of attendance. Thank you so much.